has worked.
The Solidarity Fund is a public benefit organization established to confront the COVID-19 national crisis in South Africa. It is now 18 months into the national lockdown since the establishment of the fund. Today, the fund presented its first integrated annual report since its inception. It says that it has raised over 3.4 billion rand in the period between March last year and September this year. Of that, over 2.6 billion rand has been disbursed in its 3 response pillars. In addition, the fund raised over 800 million rand to support those who were impacted by the violence and the looting in July.
A third phase of fundraising was undertaken after the Solidarity Fund established the Humanitarian Crisis Relief Fund, which was a direct response to the challenges resulting from the unrest in July. This fundraising drive raised 489 million, including 400 million that was donated by the National Treasury from the RDP Fund.
The fund says under its health response pillar, the focus has been its vaccination drive. It says 80% of its expenditure is on health responses and 20% of it goes to vaccines.
More recently, we have also funded temporary vaccination outreach sites across the country that will add to increasing the overall national number of jabs per day to achieve the 250 to 300,000 jabs daily. These additional sites will contribute to improving geographical coverage, population reach, and especially access to vaccinations.
The fund has its annual report audited by PwC on a pro bono basis. PwC found that the materiality in the report was an ongoing concern because, like any other non-profitable organization, it has no end date of existence.
We draw attention to the material uncertainty that management have identified, and the material uncertainty in particular relating to going concern, where purely because of the nature of the entity, as Zanele alluded to, the company does not have a specific period of existence, and its termination will be determined by the directors, taking into account the considering the necessity to maintain its operations.
The fund says it remains transparent as most of its projects are coming to an end. This is because the country's focus has now moved on to vaccinating citizens. According to the fund, although most of its projects have come full circle, its existence could continue until the end of September next year. Nothando Makotulela, SABC News, Johannesburg.